these kind of things can really turn things around for behavior, skin, gut, microbiome, etc. So your child is not susceptible to these infections, and susceptible then also to things like something like pandas. We don't want our kiddos for that to develop, because now we've got all these other things going on with that OCD and ticks and etc. And Canada doesn't understand pandas. The States more so does. But Canada's...
We don't seem to understand a lot of things here for some reason.
I'd give us... We're like 20 to 30 years behind.
Did you ever have bad food poisoning or, upset, or you're traveling or whatever it was? And they said, oh yeah, but that was like 15 years ago. And I've talked to other practitioners and they say it couldn't possibly have to do with that. That's too long ago. I actually find it's the opposite.
Or that's just innately who they are. Maybe they are just a kiddo that isn't supposed to be sitting in a classroom forever. And
are any of us suited to that? Speak. Welcome to another episode of the New Human Experience. Today we had an amazing guest, Dr. Taylor Bean, naturopath in Salmon BC. And yes, we did talk about vaccines, and yes, we talked about autoimmunity, infant immunity, and many, many other elements around being practitioners. And it was just an authentic, raw, beautiful conversation set here at White Lake Cabins and looking out at the trees and with some dear friends here as well. One of the things I love about podcasting is connection and beautiful communication and conversation with amazing humans. So hope you enjoy this one. And we'll see you all soon. So much intentional energy that is built here. Their body can function again. It can breathe again. It can move energy and oxygen. But the treatment book is like this. Like, it's massive. I've met so many patients over the years who were not living lives with vitality. They were living, but it wasn't vital.
Hi there.
No laughing? That's for you guys,
Shoot.
The peanut gallery back there.
Yeah.
All right. Well, Dr. Taylor, thanks for being here with me.
Thank you for
having me. We are
me.
filming in the Paddle Inn at White Lake Cabins. Mm-hmm. And we have an audience today, which is pretty funny as well. Natalia over there, host, owner, Pam,
there
Heidi, Robin. Yes, you guys might hear some heckling from the background for whoever's listening back there. But I think there's so many reasons why I wanted to chat with you. And one of them is your medical expertise, but the other one is your heart and who you are. And I'm still getting to know you, but I feel like I know you also. And welcome to the New Human Experience podcast.
Yeah, thank you. This is an honor to be here. This is awesome.
Well, and this feels like very me and maybe very us. We're in the wilderness. I'm looking at the trees and good cabin vibes in here. And that's usually where I feel most comfortable. Cabin in the woods, then pretty happy. And if I'm not mistaken, you grew up on a farm.
I did.
Also.
Yeah, I did. In Cranbrook. Horses, pigs, chickens. So all of it. Yes.
Well, and there's an interesting thread because I know a lot of practitioners. I also know a lot of practitioners who grow up more in that type of setting. And I'm not saying it's an advantage or a disadvantage. We all have our life experiences and grew up the way we grew up. But I'm curious with that as your background and the medicine that you practice now, because you're a naturopath, and please, introduce yourself even more, share what you want to share. How would you kind of see the way that you were brought up and those experiences infused into what you're doing now?
With naturopathic medicine, one of our principles is to find the root cause of disease, which means every single person is going to be different. Two people walk in with a headache or two people walk in with insomnia. It can be two totally radically different reasons as to why that's happening for them. And I think with growing up on a farm, tons of problem solving. Today the water is frozen and you have to figure out how to unthaw it, with what you have. And no one's there to help me fix it. So what are you going to do? And that's the same thing with patients. It's like, how am I going to help you? And so I'll always remember in school, one of my teachers had said, no patient is a walking textbook. And they're not. So I can't flip to page 247 and be like, well, your headache and I need to do. You can in conventional medicine, you're going to follow your algorithm to lead you to what medication you're going to use. But in naturopathic medicine, which is i.e. functional medicine, you're going to look at the whole body and figure out, okay, well, you're doing this with your life, and be it that could be a cause, versus this person's doing this in their life, and be it that's the cause. And I think that's the beauty of the medicine that we practice, is the joy for me is figuring that out. And once you figure it out and the person sitting in front of you is like, oh, I didn't even think of that. I didn't even, and you're like, right on. So it's a win. Sometimes it's incredibly simple, and sometimes it's quite challenging, and it can take you weeks to figure out what that problem is, but, or maybe not at all. But I think with living on a farm and, figuring out how to fix something, and there could be 5 different ways you could do it, is why I also love the medicine itself, the beauty of figuring out the cause. And I think with that background, doing the medicine isn't, it's challenging, but it's not something that I back away from. I think some people get into the profession not realizing, the amount of work that goes into figuring out what's wrong with your patient, and sometimes take the easy way.
Yeah.
And so, within naturopathic medicine, we have all these different things we can do, from working with pediatrics to obstetrics to maybe just men's health or gut health. But there are areas where, be it all you want to do is IV therapy, or maybe all you want to do is cosmetics, and be it that's fine. But for myself, to me, that's a little too easy. It's easy to do those things. I'd rather figure out what is your cause specifically for you, and whatever that is. Is it childhood trauma? Is it a nutritional deficiency? What is it exactly? And so we have to look under the hood, and we have to get real and raw of what's going on. And sometimes people don't want to go there. But when you ask them in, permission of, can I ask you, is everything on the table? And they say, yes, everything is on the table. Okay. Because we're going to go places maybe that no one else has gone, and you might make you feel a little uncomfortable, but we have to go there in order to figure this out with you. And I think that's very much appreciated, because no one's ever done that with them before.
Yeah.
Usually. So, yeah.
Well, and that's something I've found in practice as well, that, for anybody listening, I'm a Chinese medicine doc by trade. And I think this is where you and I have parallels, is really interested in getting down to the root issue. And I love investigating that in the deepest ways possible. And if we have everything on the table, then we're going to see things that we haven't seen before, and the patient's going to get illuminations that they haven't had brought into the light before, of causes and different influences that they had no idea about or they weren't thinking of. And then we have time, or we've chosen to take time. Everybody can, structure their clinic and office visits how they want. And over the years, my clinic time got longer, whereas I think most of my colleagues and things, you'd get more efficient. You don't need to take as much time. And I found the more I learned, the more actually I needed more time, and I wanted to go deeper. But that's also what led to miracles and breakthroughs and, challenging cases where, I want to get into that meaty stuff. Or I'm sure you've seen a lot of patients too, that they've seen 20 doctors or 50 or sometimes more. And I'm not exaggerating. And then I'm like, okay.
I'm the last one you're going to see.
Let's see. Or when patients directly say that, you're my last hope. I've seen everybody. Can you help me? And I don't always know if I can, but deep down, I know that we'll uncover something which may lead to the beautiful outcome they're looking for, or will at least get going in the right direction in a big way. But I also refer out a lot, because I have the things I think that I'm really gifted at and really talented at. And then there's a lot of other people like yourself and other practitioners and colleagues of mine that they may have a different view, a different insight. And so, there's a lot of that collaborative, the village vibe a little bit. And I tell patients all the time, like, health is a team sport. And this is what really I think has been effective in my practice, and sounds like for you as well. Like, you take time to get into those places that are often unexplored.
Oh, yeah. No, it's a minimum of an hour you spend with patients. More 90 minutes now I'm spending, particularly with children on the spectrum, or if they have something challenging that we need to discuss. It's 90 minutes because 15... we're not even going to, it's a hello, 15 minutes is gone. But you need that time, and investing that time in order to really get to hear someone's story, to figure out and speak from the beginning to now, from pregnancy and labor to today, what happened, where was the point, the fork in the road that you noticed a change, if we're talking about a change with your child. And then finding those triggers, and be it that was the cause too. So then we know what we can do. And sometimes just figuring out the cause is healing as well. And being I haven't found the solution yet, but just figuring out, okay, identifying the cause of this was potentially the reason that this happened. Okay. Then we can move forward to of like, okay, this is what we're going to do. This is why we're going to do it because of what this particular reason. Yeah.
Well, and I've always found maybe I'm this way. I ask a lot of questions. Probably that annoying kid in class. Kevin, that's enough. No more questions, please.
Right. Yeah.
And I like knowing things and understanding because then I can apply it very practically, and talking about farming or all the other jobs I've had in the past, you have to find solutions. It couldn't just leave it alone or, you know what, we're not going to feed the animals today.
Right.
Sorry.
Right.
I just can't figure it out. You always find a way,
Always
but I
find-
do
yeah.
find that practicality of getting results in the clinic is really needed.
Yeah.
And I don't give up very easily. And, I'm kind of tenacious with trying to get at the root issues. And the conversations around like going into the past is a big part of what I talk to patients about, because I often am looking for those moments where they say, I never felt the same after that. Whatever it was, could have been physical trauma, emotional trauma, could have been infections, could have been food poisoning. I see a lot with gut issues over the years. And as I go deeper into their past, did you ever have bad food poisoning or, upset or you're traveling or whatever it was? And they said, oh yeah, but that was like 15 years ago. And I've talked to other practitioners and they say it couldn't possibly have to do with that. That's too long ago. I actually find it's the opposite. It always has something to do with it. And they said, how did you feel after that? And they're like, I never really recovered and my digestion hasn't been the same since. And so practically, farmer brain, doctor brain, what happened there? Something happened that shifted your microbiome or shifted your capacity to digest food or all of the above, and it's still irritating. Let's go back there.
Yeah.
What if we didn't overthink it? That happened, then it changed things. So we need to go back at least that far, and then I'll keep going. And so this is a lot of what I spend time doing when I'm chatting in those longer visits. And I also think too, we have a couple threads here for the nervous system. If I went into a visit and it was 2 minutes or 5 minutes, and just me personally, because I'm often thinking of everybody else in the room, if there's a waiting room around me as well of 20 people that have been sitting there, I'm probably not going to share what I want to share. I'm probably not going to take the time, or I feel unsettled. How can you share those really, really deep moments because you either don't have time or you don't feel safe to do so? So I do find sometimes it takes 20 minutes, half an hour to get down to the really deep stuff. Yeah. And then each time you see somebody, there's more connection. There's more of a relationship established that, now we can get further. And that's where all the old stuff starts coming up. And a lot of the older material, in my experience, it seems to be completely causative in what's going on. And then, like you said, as soon as you unearth some of that or speak to it or name it, or there's that aha moment, people's bodies start to shift around that just from somebody having helped find that with them. It's like hide and go seek a little bit.
Oh, yeah. And I mean, there's a lot of trust building within that, of course, where in 15 minutes, you're not going to tell me your deepest, darkest secrets. And so it's that building trust between the two of us that you can tell me. And there is no shame in that. And I'm not judging you. I need to know it in order to help you. But that takes a bit. Men and women alike, there will be reserved and not used to that either. They walk in thinking, okay, well, Dr. Bean will just fix the problem, but I don't really have to tell her everything. And then it's...
You have to tell us everything.
Actually, I need to know these things. And then, So yes, absolutely with gut stuff. I mean, what's interesting about our professions is intuitively we will know that that's a problem. And in naturopathic medicine for decades, from something so simple as leaky gut, naming it leaky gut, but that wasn't proven until probably the past 5-10 years of actually scientifically being able to prove something like that. So gestalt impermeability, knowing that there's actually a mechanism there that now everyone's like, okay, leaky gut might be your problem, where intuitively 30 years ago, before the science, we knew that and couldn't name it. We just knew it was a problem. So to what you say of, travel, gut problem, I mean, there is science behind that as well. An autoimmune condition can develop from that. So it's a real thing. It's a real phenomenon that you yourself have known and recognized. Don't need show me the science, not necessarily, because intuitively we know that it's a problem. And today it is shown that it is a problem. It is.
Yeah.
From getting traveler's diarrhea, you aren't the same after that. If you didn't treat it properly at that time, which you probably didn't, nor
Yeah.
knew that you had to prevent that problem. So even to anyone that travels, I just went to Mexico, bringing things to, in case you get traveler's diarrhea, to prevent probably the long problem is also important for people to do too, to prevent, that digestive microbiome imbalance for, a decade down the road. Yeah. Yeah.
What's, there's a number of things that I am always curious about with every single patient that comes in. Do you have anything pretty specific that has become more of your go-to of things that you want to understand right off the bat, of almost like kind of home bases?
Right.
Here's the parameters for you to understand a case. And,
Right.
if A, then okay, I'm going to step B. And then, if I find that, then I'm going to step C, or anything that you found the last bunch of years that are, kind of more, more impactful, or like patterns.
Well, so the demographics of people that I see used to be more specific when I was working on the coast, because pediatrics was my main, and now working in Salmon Arm, I see everything. But I do see a lot of patients with just idiopathic. We're not sure what's wrong with me. Typically, it's going to be pain and chronic fatigue. So with that is usually going to me, the big things that come up are going to be mold and infections. Usually I will dive into making sure that is absolutely not a problem. To me, infections are going to be 80% of the problem for most people. Low grade, be it was, Epstein-Barr virus or a herpes virus for that matter. But then going into tick-borne illnesses. So, going into Lyme, Bartonella, Babesia, etc., and making sure that is not part of what we're dealing with. And then mold. And a lot of people, will dive into the mold piece because it's impossible for mold to be a problem. My house is brand new. Actually, it is still can be a problem. Mold absolutely can still be your problem, depending.
Yeah.
And so testing for those things possibly to rule that out too, because those are the things that are creeping in the background. No one's going to talk about, typically because no one really understands how to treat them either. How do you treat mold and how do you treat these infections? And from the conventional model, mold doesn't exist and Lyme also doesn't exist in Canada. So, and we all know that's not true.
We do.
Even the CDC,
a lot of us do.
A lot of us know that's not true. And even the CDC has stated now 450,000 cases of Lyme disease per year. So you've got the US and then Canada doesn't even recognize it. And even the treatment for that is, 3 days of doxycycline and that's it. But be it's something, but it's not appropriate in terms of treatment or taking it seriously enough, or, counseling you to keep the tick and then send it to know if it did have something in it, and then we'll treat you appropriately. So, because that takes a long time to rear its ugly head when it comes to Lyme. And that can take 6 weeks to show. You get bit in August, you're going to have issues within October. And you don't even know why. And you're not going to correlate the two together because it takes so long for it to develop. So those are things that are always, but the thing is, I attend conferences that are all about this kind of stuff. And so my hat is on for all of these other areas that but not to blind me to maybe the obvious that's sitting in front of me either. But it's there because no one else really works in those areas because they're tough, challenging, and what do you do with it? So there's
kind of the cart before the horse sort of analogy here. You've mentioned a few things that are really important because I want to talk about infections and chronic and latent infections a little bit, because this is something I work in really extensively in like toxicity and Chinese medicine viewpoint on lingering pathogens, we call it, or GU syndrome, like GU. And that's kind of a catch-all phrase a little bit of something that was understood for thousands of years, that there was something going on in people's bodies that were making them sick. They didn't have the terminology or naming, tick-borne illness and those types of things and all the different infections and co-infections, but they knew that there was something lingering, and the Chinese medicine translation is like lingering pathogens. I would definitely say that in all my years of practice now, lingering pathogens are one of the top reasons why people have chronic illness. And, we can get into the mentally emotional part a little bit, but even if we kind of rewind for a moment around like healthcare in general, and we see the different systems that are available, if something doesn't exist, or we don't know how to treat it, and sometimes those are in the same category, then it just doesn't get any attention.
Right.
And so the thousands of patients that I've seen that have done many, many, many tests and so much blood work, and I might ask them, have you ever had mold tests? Or have they ever tested you for this and this and this? And they'll say, no. And I think partly, what were they looking for the whole time? And why aren't these things being addressed a little bit more? Because somebody might live in a new house now and say, no, I'm good. There's definitely no mold in there. But they did live in a student scenario housing, and I went to Chinese medicine school, Lower Mainland, super moldy down there, old houses, black mold on the windows, and going over to visit some of my student friends, and you'd be like, oh, I don't think that's good over there, and you're like, yeah, whatever, it's a bit musty in here. Meanwhile, like the parts per million of spores in that room are probably ridiculous, and 20 years later, somebody could have chronic fatigue or fibromyalgia because of that. But it's been overlooked so much, and there's, I don't know, I live in a new place, my office is great, and it's not always now, it's older. And so what I've often found is the stacking of chronic infections in the body is what leads to a big mess. And then people are coming to you or me and wondering what is going on in there. And you have to kind of sort through all of it because it's not just one thing now. And so I love that approach of, let's check on a bunch of these things and see what we're dealing with, because if you don't know what you're dealing with, what are we doing for treatment? And that's what I find with many patients I've seen is they've had a lot of treatments, but it was all shots in the dark or, well, let's treat you this way and see what happens. And I love getting way more specific, and it sounds like you do as well. So any of the things I've shared, feel free to unpack a little bit more of even maybe some of the tests that you do or some of those steps, just so it's like practical for people too. If they're all wondering like, oh my God, what? There's so much mold in my past or whatever it has been. There's stuff you can do.
So signs and symptoms, obviously, what is that you have that you walk in with? And so let's say chronic fatigue is the big one. You're like, I checked my iron, I've checked my thyroid. To thyroid, though, a lot of people don't get a full in-depth thyroid panel, and you can't with your medical doctor. MSP won't pay for that. And so MSP won't pay if your TSH is within its reference range. So then you see a naturopathic doctor, and we have to go private, so you can pay out of pocket. So then we get a full look at the thyroid. A lot of people don't have their antibodies checked. So I have a lot of Hashimoto patients in my clinic, and I find it because we check. And it's like, okay.
Yeah, and they didn't know what was going on.
They didn't know what was going on. And so the medical doctor's just going to go, TSH is normal, your thyroid is fine. We're not sure why you feel this way, although you're gaining weight, you have constipation, you're losing hair, massive brain fog. You're walking screaming hypothyroid, but your TSH is normal. So we have to go further with the testing. And I find a lot of autoimmunity in patients. I'm like, okay, so this is telling me something. Your immune system is not okay. And so what also they'll be told is that most people have antibodies will be positive. And that's becoming normalizing an abnormality that's happening as well. So I'm like, well, no, if your antibodies are high, we're going to work with that. And I'm not going to say it's normal, because I can say it's normal and then just not do anything about it. So we're going to do something about it. Totally.
Just bypass all these things.
We're going to just call it normal. You're fine. Get out of my office. No. So we have an autoimmunity, and be it, you are now up for another autoimmune condition because that's there, and it could lead to another and another. So then we work on that. Now, if your listeners don't know, LDN, low dose naltrexone, is probably one of the most used medications that I will use because it's an immune modulator. And I use it in children as well. And it really helps to reset things in the moment as well. And to eczema, I've like miraculously with eczema, and we're trying everything as well. Plus, when it comes to children, they're not going to take everything. So you also have to choose things that which they will do as well. And there's things like foot baths and what have you that kiddos may or may not do to help them. But LDN, autoimmunity, pain, has been an amazing medication, which we're not going to use forever. We're going to sort of fix the problem, and then we pull out and we don't use it anymore. So testing to the thyroid, to your iron, and then to infections. So you can free in British Columbia, and be it wherever you live, you can do what's called IgM testing to see if you have acute or chronic infection. And I will do Epstein-Barr virus all the time, EBV, because mono, which is what EBV is, you get it when you're a teen, And then you can have that chronic fatigue just lingering, but it's not looked at or tested because I think they're not sure what they would do with that information.
Yeah, the treatments is
like, well, so you
yeah.
have EBV and now what? So there's lots of things that we can do with that, but we want to test to see if you either A, can mount immunity, B, you've seen it in your past, or it's an acute infection right now, which I've found a few in my chronic fatigue patients. So it's a free test. You can send it to the BC CDC as a naturopathic doctor, or your medical doctor can test for those. So we can use our local labs first and foremost. And then second to that is we can do mold testing. So we send it to the States. I will test for Lyme and co-infections. We'll send to Germany. Can use the States as well. We'll see if pricing goes up using the States. So I'm going to have to seek elsewhere. But Germany has some great testing for the infection-related problems. Beyond that would be heavy metals. Potentially we can test for those. Hair is what I prefer. Hair also tells me of lithium levels as well. So lithium, which is an incredible nutrient that's found in our soil. A lot of people are deficient in lithium orotate.
Yeah.
And that can be related to not necessarily your lack of energy, but mood too. From, addictions to suicidal. So these are another area, not that the lithium is going to save everybody, but it is an important part. So hair I will use to look at those metals and those nutrients. Beyond that, then we're getting into some nuances, but those are in terms of mold, metals, and infections. But locally, we can use a lot too before we have to spend a lot of money on these other testing, which does get expensive. Yeah.
I find in health nowadays, you get what you pay for. And some people don't like hearing that. But this morning, for example, it came to mind. I like using real world examples. My rear tire on the truck was a little low. And so we stopped by the gas station and there's free air. Sometimes you got to pay for it,
Fair enough.
the air compressor.
Yeah.
And I'm like, oh, free air. This is great. So I go to fill it up. And I think it let air out of my tire.
Oh, no.
And I'm holding it there for 5 minutes and nothing's happening. I could just hear the tiniest little whistle. I'm like, there's barely anything coming out of this free air. And I know there's one across the street that's pay.
Yeah.
And I just got kind of fed up with trying to fill up my tire because it was taking forever. And I actually literally think it let some air out of my tire. Anyway, I'm a farm kid. I know how to use an air compressor. Just want to say that. So we drive across the street. And I paid. I'm like, no, I'll pay because I know this one works. And I had my tire filled up in a couple minutes.
Yeah.
And it did come to mind ahead of this conversation that, we're in Canada and healthcare is free mostly, but it's not. And we could get into the politics of that. But I find this is where things are lacking. And I'm not trying to run doctors down anywhere. I know nurses. My mom was a nurse. I know a lot of practitioners in the conventional system, but the system itself doesn't seem like a framework that allows maybe all the practitioners to do what they would like to do, which is maybe have more time like we do. Yeah. So people have to pay us to come and see us. But I do believe we deliver really high level results because we are going to investigate more and more and more, maybe beyond what the conventional scope would be. And that's often where I find the huge results will show up is the extra levels of testing. The basic stuff may show things from time to time, but it still doesn't give you much data to go on, or you might see a marker here and there, which then in my mind points me to a bunch of other things, but it really doesn't tell me a lot. And even a lot of the training I've done in biological medicine, New German medicine, and a lot of the other kind of more European viewpoint on these things, in addition to Chinese medicine, you can have like 70 to 80% cellular changes and function going on before it might actually show up in chemistry in the blood. So many patients come in and they feel like garbage, but their blood work is fine. The basic blood work is. And I think this is what we're talking about a little bit is you got to go deeper because there's more, there's clearly more going on. And they might say, oh, I saw somebody had some tests and they say I'm fine and I'm healthy as a horse. I hear that all the time, but they look like hell. And they don't feel good, and they're in pain, they're fatigued, they're not sleeping, they have huge brain fog, they could have a million other symptoms. Blood work's good. So this is where I think we divert off the beaten path because we have seen enough patients now that we know there's more to the story. And then when you investigate properly, you start finding really good data, and then you can do something about it. And so these are sort of two sides of a similar coin one of my teachers I remember in Chinese medicine school said, here's a big difference between, conventional medicine and Eastern medicine and philosophy. Chinese medicine views the body as a garden, and Western medicine views it as a machine. And one of the other things as we got further into our clinical rounds and things like that in school was they said, Chinese medicine is really interesting. Like the diagnosis book is only this thick. Like it's not huge, but the treatment book is like this. Like it's massive. Whereas conventional medicine, the diagnosis book is massive, but the treatment available option is pretty narrow. It's, medications, most of which are suppressive in my view, that don't necessarily get the root issue. And I'm not saying there's not a time and a place for that. I've had surgery, grateful for anesthetic. Didn't have to just somebody put ether over my face and bite a stick or something. Like that was nice. But afterwards, what's being done to clear that from my system? And what I've learned is it doesn't just clear necessarily as maybe they would say, oh, that'll be gone in a few days. Right. Not so. Yep. And so same thing with Epstein-Barr, same thing with infections. They have these lingering and latent infections that get deep in the body that go unmet or unseen for decades, only to land, in your office or my office. And then, we're wondering what's happening there. So all that to be said, I did get my tire filled up, but I noticed that I paid for a superior service, and that's how I run my life. Yeah. And it's challenging if somebody's short on resources because, we're in Canada and inflation and all the rest. It's hard to do that. But I'm really clear on it for me that is where I vote with my dollars is health and vitality is my number one value. I have a pretty simple lifestyle outside of that. And so most of my resources go into that. And I would say I probably spend more on my health than most of my patients do. And they're like, yeah, but you're not sick. And I'm like, that's the point.
Yes.
I'm not waiting to feel that way. And I'm going to keep investing over the long term because that's also Chinese medicine's, play the long game.
Yeah. Agreed. I think too, Canadians, just when you see a medical doctor, know that your medical doctor does have to have clear understanding of why they need to do certain tests. They're not just going to do every test that you ask. And the reason is because they are using taxpayer money to do that test. When you see a naturopathic doctor, no one cares, meaning you can do whatever you want because you're paying out of pocket.
Yeah.
So I have patients, I don't understand why my medical doctor won't do it. And I ask and they won't do this for me. Just know that the medical doctor has to have reason to do that test. They're not just going to do the test just because you've asked. Just for people to don't get angry at your medical doctor when they don't do it for you because they have to have good reason to do it. Where I also have to have good reason, but you also are paying out of pocket for a lot of it. So no one cares about that. My college doesn't care and no one cares because you're paying out of pocket. So there's a big difference too. You are paying for a service and you're going to get, and you're in the driver's seat. I mean, as a patient, you're in the driver's seat of what you want. And we'll go through that Life Labs requisition form. Like, I want this. I want my vitamin D, my B12. Awesome. Great. My testosterone, whatever it is that you want to test for, we can do that, but you have to pay for it, unfortunately, which is what our U.S. counterparts do. And that's, part of it. We're just so used to this is free, but you are going to get what you don't pay for. So although you are paying for it. Yes, in a roundabout way.
What's well, and we'll segue in a few different directions here, I'm sure, but is there anything that you're seeing, especially the last few years, in some of the tests that is an anomaly or, maybe was an anomaly and is now more regular? I mean, you shared it a little bit, the autoimmune markers, positive tests coming back in way more people, and it's almost becoming normalized, even though it's not. Yeah. Is there anything else that you're seeing in some of that stuff coming up the last few years that you're like, oh, wow, look at that wave of this?
No, I would say it's the autoimmune markers, hands down. Your non-specific autoimmune marker, your ANA, I will test for in the thyroid. I can't test for everything, but those continuously keep coming up. It's like, oh, there is a lot. When I could, pre-COVID, but even during COVID, I was testing a lot for D-dimer, which is your non-specific clotting marker. That was taken away for some reason. And only if I was on the coast, I could do it. But here in the Shuswap, Okanagan, and the rest of the province, Life Labs won't do it. So you have to be on the coast in order to do it. And I was doing, so a lot of D-dimers were coming up pre-COVID, because it actually can mean other things. It can actually be related that you have H. pylori infection. But a lot of my Lyme patients had higher D-dimer because they just have thicker blood as it is.
Yeah.
But that was a marker that was coming up. And so treating that, and fibrinogen was coming up, and all the clotting ones post COVID, which matches. But that one, so it was interesting to be able to do that one and have those positives, and then treat accordingly. But it's the autoimmune, it's the immune overarching, I think, has really, I've noticed changes, and in children.
Yeah.
I am seeing autoimmune markers in children.
Yeah.
Thyroid is also off on children, which has been, but if we have the opportunity to check, thyroid is off in children. So maybe your ADHD inattentive child actually has hypothyroidism instead. And so I've treated it, and then lo and behold, the child is able to focus. So there's all magnitude different things of why a child can't do X and we think they could. And we have to find that, or that's just innately who they are. Maybe they are just a kiddo that isn't supposed to be sitting in a classroom forever. And
are any of us suited to that? Speaking for the
totally,
teenage boy phase of my life, and
no, you're not supposed to sit. You're supposed to be outside running around, and kudos to all the homeschool families.
Well, and a couple of pieces here too that even neurologically, just because the symptomology is there, it doesn't mean that's where it's coming from. Because what you just named, that's more endocrinology, but it was affecting neurology in a big way. Right. And I have found that time and time again with all the different systems. Just because you see a fire in one place doesn't mean that's where it started. And so this is what I love, retracing of what's triggered something, what sparked something in the system. Yes, this is a presentation. What is everything that's had a hand in doing that? And so this is what I love in more functional medicine or Chinese medicine and looking at toxins. You can get into that, but then you can treat it. Because conventionally, this is only kind of one aspect of treatments. And, from a chemistry point of view, and I spoke about this recently at a conference, that I believe we're electrical before we're chemical. Our whole bodies are electromagnetic beings. And so the chemistry is the downstream effect. And so if we're altering chemistry, it's not actually going to get to that root issue. Whereas, something like active Epstein-Barr, other latent infections, they will disturb the electrical voltage of the network. Absolutely. Depending on where it's impacting. Could be thyroid, could be brain, could be muscle response, nerve response, very physical, gut, vagal tone, all of it. And then you work on the viral piece to bring integration or harmony or clear from the system. Suddenly all those other systems are back online again with that one thing that seemed unrelated. But the more I practice, the more I realize that everything is related.
Even physically, like fasciculations that you'll see. So either the eyebrow is flicking or the thigh is flicking. Mold can be a cause for that, which, these are the things, these nuances that, we learn about. With medicine, it used to be 80% used to be taking signs and symptoms. 20% was labs to really tell you what you already know. But today it's flipped. It's 80% your labs and 20%. Even patients constantly I go in, they didn't even touch me. They didn't even look at me. They didn't take my blood pressure. They didn't do anything. They didn't even make eye contact. And so they're looking at my labs and being like, nope, looks like you're good. See ya. And I understand that it's the system is the problem. It's not, it's not the doctor. It is the system of you get 7 minutes. And so, but really it's acute palliative care, and you should expect that when you go in, be it you're asking for a referral or blood, but don't expect to look for root causes. That's just not an expectation we should have anymore. And that's where, it's the team piece. I want my patients to have a medical doctor too. It's just things that they can do that I cannot, or a different eye approach on something. But some of these latent components, your medical doctor unfortunately isn't going to be, that's not the medicine that's there. It's not the medicine. It's surgery. It's acute. It's palliative. That's the slice of medicine that's there, where I'm here to find the root cause, but I am not the person you would see for surgery. So knowing the difference. Yeah.
Well, having the right tool for the job, a little farming background too,
I guess I could.
makes a big difference to have the right tools.
Duct tape will fix it. Yeah.
Yeah, I mean, we could use duct tape too.
Fixes everything, yeah.
I think I would love to hear your take on what is autoimmunity, because I'm seeing it's rampant. We're at an exponential growth curve in like every kind of diagnosable autoimmune condition right now. For a lot of people, health practitioners aside, that's pretty alarming. Why is this happening? I have a lot of, speculations on why that is. But even before that, what's your take on what is it? Like, what is autoimmunity? And maybe it's just the infection pieces, but what do you think is actually going on in the body for people that are trying to understand what is happening for them if that's showing up?
So autoimmunity essentially is our immune system is attacking itself. And there comes, and which isn't actually in the literature, is showing when we activate the immune system over and over and over and over again, it actually turns on itself. And then it starts to attack itself. And there's different ways that we can activate the immune system over and over and over again to do that. And basically we have an immune system. There's different arms to the immune system, and they have different roles in the body. When we heighten one of those, we're going to have problems. It needs to be a balancing act. And this can start from birth is when this can start. And then you don't see an issue. Depending on how many times you activate the immune system, you might see it when you're 5 years old. You might see it when you're 20. You might see it when you're 80. So we don't, and it's going to be different for everybody because epigenetics is going to play into that as well. And how well you can remove things out of your body, which is activating the immune system in that time frame as well. So be it you don't move versus you move and you exercise, that allows for things to get out of the body too through sweat and lymphatic movement, etc. So in terms of autoimmunity, and they've done this in rats, where to have them develop an autoimmune condition so then they know how to treat it. And how do they do that? They activate the immune system over and over again. And what they're using aluminum. And so aluminum is an adjuvant. It activates the immune system. That's its point. So they're going to inject it now, not in adults do we do this, but in rats, they're doing it every single day. And so by way of injecting them every single day with aluminum, activate the immune system, they develop an autoimmune condition.
Yeah,
now you need to develop the medication to treat that autoimmune condition, because you need to create the problem in order to find the solution in conventional medicine. So then whatever the autoimmune condition is, then create X medication and then fix rat, hopefully. And then, then I guess that will work on adults. Now you move into phase 2 and phase 3 in terms of your clinical trials and making sure that that's safe and effective, as they say, for humans. So that's how they develop it. So aluminum, where do we find aluminum?
I don't know. Can you tell us?
Audience, where do we find aluminum? Yeah, so there's a lot of places that we find aluminum, and not all aluminum is created equal, I think is also first to understand. You have your aluminum foil, your aluminum cans. You can find aluminum in your food. Yes, you can, but it is water soluble. So whatever you eat and drink, you only absorb 0.1 to 0.3% of that. So very little. And whatever you do absorb, you're going to work to get that out because it's water soluble. So which is, I think, important to understand, because the differences, because you'll see, there's, 10 times more aluminum in infant food than there is in a vaccine, for example, because vaccines are the other area that we find aluminum. And you're right, there is 10 times more aluminum in that food than there is a vaccine. But when we compare those two, we're comparing apples and oranges, from food to vaccination. So food, again, you only absorb so much of it, and your body will work to get that out over time because it's water soluble. Now, which things like glutathione will help, and minerals will help in terms of bind and pull, and good lymph system, and your sweating, because through sweat we can get rid of a little bit of aluminum.
Yeah.
So all these actions also to get rid of it. Now, to vaccinations. All vaccines before a child turns 12 months have aluminum except the rotavirus. So in the United States at birth is the Hep B vaccine, 250 micrograms of aluminum. It's quite a bit. And then we have our 2 and our 4 and our 6 month vaccines. We're going to use an adjuvant to stimulate the immune system, because if you didn't, the body wouldn't respond. You would just be inserting an antigen and the body be like, well, I don't really know what that is, whatever. But by using an adjuvant, we're going to stimulate that immune system. So the aluminum in that vaccine, when you inject it, it turns into two parts. It turns into a water soluble and non-water soluble. That water soluble will move and the body will remove that. But the non-water soluble form binds to that antigen. So they bound together and hovering in your arm or the leg, wherever you injected it. Then the immune system, the innate immune system, comes over, phagocytoses or eats that antigen, which is bound to the aluminum. And then it will go to your lymph nodes and present it to your B and T cells to kill and make memory. Now it's in your lymph nodes. It's in your lymphatic system. So that aluminum now is there because that innate cell died. There's the antigen, which is, be it denatured, but now we have aluminum. And now it needs to work its way out. And that takes a long time because it has to go from lymph to blood to kidneys, and then you remove it. So one way that I will use with families in order to help them remove that aluminum is foot baths.
Yeah.
So foot baths, not a lot comes out of your feet. That's not really what it's doing. The color will turn brown because you've got salt and you've got ions in there, either positive or negative. So it's a rusting effect. A little bit will come out of the feet. So the epidermis or maybe the dermal layer stuff will come out. But what happens is that if your feet are in a negative charge, aluminum is positive. That aluminum will move from be it inside the cell or it's outside the cell, will hit the lymph and then the blood, and then we pee it out about 96 hours later. So it's one tool that I use to help families remove that aluminum because we do want to get that aluminum out of the body.
Yeah.
Now, usually I'm not seeing those patients until later. So be it they have in the States, you have your first vaccine at birth, then you have it at 2 and 4 and 6. There's an accumulation that's happening. And so again, back to the point of the aluminum is to activate the immune system. Infants cannot make immunity. They cannot make immunity. They cannot make immunity towards viruses and bacteria, not till around 9 to 12 months. They make immunity to food proteins, though. So when mother is breastfeeding, the baby's body is seeing, oh, that's a banana and that's a kiwi, whatever mother is eating, the baby is learning self from non-self. So it's making memory. So we have two arms of the immune system that we talk about, which is called Th1 and Th2. So Th2, the infant is born with. And that side of the immune system is making memory again to these food proteins. And when Th2 is heightened for long periods of time, we see atopic conditions. So allergies, eczema, and asthma. But Th2, they're born with. They can kill and they can make memory to just food proteins. And so they're learning this through mother's breast milk. The side of the immune system that makes memory to viruses and bacteria is turned off. Th1 is turned off 2 ways. Through breastfeeding, because the baby's body realizes, oh, mother is going to provide me immunity. This is called passive immunity. And so mothers will provide antibodies towards pertussis or RSV or measles, etc., if she has immunity to those things. So she will provide that. And so baby's body knows it's protected by these infections through breast milk. So it doesn't have to worry about making memory. It makes to viruses and bacteria because mama is helping, and then do it to food proteins. Also with that, if you're not breastfeeding, it's fine, is this other way is the baby produces IL-4, interleukin 4, which is used in immunology, but not in this circumstance. IL-4 is secreted through the whole baby's body to help with memory and cognition. It's there on purpose. But what it does is it suppresses Th1 while being secreted throughout the body. So we have through breast milk, Th1 is suppressed, and through IL-4, Th1 is suppressed. So there is no way Th1 is coming on board for a baby. Because when you make memory to viruses and bacteria, it is very inflammatory. But an infant doesn't know how to deal with the inflammation.
Yeah.
Therefore, suppress it. I don't need to make memory. Mom's got my back, and I'm going to remember all the food that she's feeding me. And then by 6 months, mom starts to reduce her breastfeeding. And so then the body realizes there's a transition. And by around 9 to 12 months, I mean, it's not cut and dry, but the research shows 9 to 12 months, an infant, when it receives an antigen, it can make an antibody to those viruses and bacteria. The seroconversion is strong between this 9 to 12 month window because there's a change up. And so IL-4 is reducing, mom's reducing her breast milk, we're getting food, the transition is happening. Now, in order to activate that Th1 arm, adjuvants are needed. So aluminum does that. Aluminum will awaken Th1 at 2 months, barely. And then Th1 goes back to sleep. And so we make a little tiny bit of antibodies the infant will make. Almost nothing. Then 4 months, it's awoken again. And then at 6 months, it's awoken again when it shouldn't be. Mm-hmm. And that's just how the human body is designed. Now, why are vaccines given this early in life is usually a big question. Well, in the United States, mothers go back to work at 3 months and have been. So in order to protect, and public health decided in order to protect those babies that go to daycare, let's give them vaccines because mothers go back to work. They could go back to work at 6 months or 9 months, but that's just how it is in the United States. So they go back to work at 3 months, baby is more vulnerable, and the whole point of vaccination from public health perspective is keep people out of the hospital. You might show signs and symptoms, but you're okay and you get through it, got some sniffles, but we don't want to see you in the hospital. We want you to see in the hospital for actually blunt trauma, not pneumonia. We don't want to see infants in here. Yeah. So their thought process is we'll do vaccines at 2, 4, 6 months, and we're going to prevent you from coming into the hospital. Yeah. The CDC developed their schedule, and the man behind that is Dr. Stanley Plotkin, who is still alive, and his whole life work was educating public health agencies throughout the world. So Canada to Australia to Europe, we have similar vaccine schedules, a little bit different, but the bulk is done in infancy is where it happens. Mm-hmm. Due to the philosophy, well, if we do it this early, then be it babies won't come to the ER with, they're coughing and pneumonia, etc. Yeah. That's the whole reasoning. But behind it, though, is we do need to understand how infant immunity works. And that is how it works. They cannot make memory to viruses and bacteria, and they're built not to. We can try and turn it on with Th1 driving forces, and that's aluminum. And even the research realizes that even aluminum might not be best at activating Th1, and they want more Th1 activating adjuvants because there's a locked-in Th2 with infants, and it's fully understood that. And so within vaccinology, the discussion is looking at different adjuvants. What would be a better driving force to increase? Not necessarily, well, this is how it's built, and this because to public health is still, we can't have infants come in with infections. But we could take a step back and look at the entire body from a functional perspective and say, okay, well, breastfeeding, if mom can breastfeed, and we can test mom for what she has immune to, that is one of the best ways to protect babies is through breast milk. They're designed to work together. If baby is ill, baby's saliva will retroactively go up her breast, and her body will read that saliva and produce those antibodies and bring it back to baby, which is fascinating. Yeah. Fascinating.
Nature.
The connection is just incredible to know that. And so we're not broken. The design is very specific in terms of the human body, and we try to muddle it for sure, but we need to take a step back and say, okay, well, there are infections, and let's look at, what are the infections that drive infants into the hospital? Has that increased or has that decreased since the vaccine schedule has come in? Is it just as bad or is it even worse? And I would say it's worse. And behind that is also going to be our interventions that we do from in pregnancy, but more so at labor. What are our interventions that are happening? And when baby is sick, what do we jump to? But you're going to jump to antibiotics. Well, welcome to affecting your immune system right off the gate as a result of doing that. And so when children come into my office and let's say they're 12 months or they're 2 years old, I've had kiddos that have been on rounds and rounds of antibiotics. And what's standing in front of me is a very, very sick child, unable to focus, dark circles under the eyes. We've got eczema that's not good, like really bad eczema. Not sleeping well, and we've got constipation. So it's like we have all of these things happening, and no fault to that mother and no fault to you if you're listening. But this is the system that's in front of you, and this is why you're listening, be it you can find a different way of doing things, and or we all can do better when it comes to children, because those first 2 years of life are the most important, particularly for the microbiome. That's when imprinting happens. And you're going to really screw things up when you practitioner are saying it's antibiotics versus maybe I need to flood you with probiotics. maybe I need to flood you with your vitamin D because vitamin D is critical to support you. And you know what? You're inside and you were born in winter and there's no sun and mom is not taking vitamin D. And mom, 10% of what you do goes to your baby. So if she's taking vitamin D, at least 10% goes to baby. And these are all preventative measures to make sure that an infant doesn't land into the hospital. And be it from the United States, maybe you need to be 12 months mothers are off work, not 3. It's ridiculous. I mean, the Middle East is 6 weeks. I mean, this is just profound to me that you would think a mother is going to go back to work at 6 weeks. No. So we need to match we need to match infant immunity when it comes to mom and breastfeeding, first off. And so if a baby can't make memory until 9 to 12 months, then our push and support should be for that mother to take care of that baby until that time to reduce these infections in infants, not put them in a daycare where they're going to be exposed. And what's interesting too, pertussis is probably one of the highest of all the infections we can vaccinate against. Pertussis is still very amongst us. And one of the reasons, which is research has stated, there's 4 main reasons. And one of the reasons is because those that get vaccinated with pertussis spread it. They colonize it and then they spread it. They're not shedding, that's different. They're spreading it. And so with that, we're going to maintain pertussis. So your baby then goes to daycare or preschool, and be it there are 2, 4, 6-month-old babies in there and 18-month-old babies in there, they would have just received their vaccine. And now we're circulating and spreading. And if that child is not breastfed or doesn't have the nutraceuticals to take care of them, I mean, vitamin C is one of the top things to help support against pertussis. They've known it since the 30s. But if we're not doing that, we didn't know that because public health isn't educating you because they should be on all the things when it comes to immune system. Vitamin C would be a preventative measure. And you can give vitamin C to children and infants a little differently, but you can. So these are the things to prevent, I think, in terms of public health measures. Vaccine is a tool, but also your tool is not going to work when your immune system can't do anything with it, which means an infant can't very well, or obesity. If you are morbidly obese or obese, you can't make immunity very well. And then you're counseled to take, well, if you get a COVID shot, you can take a donut. Well, now your sugar is going to suppress your immune system to make any immunity to that vaccine. So all these things just, we're not looking at the bigger picture. What is the big picture? Keep people out of hospital. Okay. So then do all the things which would do that. And that means supporting the immune system, be it its timing, it's how you use the tool and when you use the tool and how many times you use the tool. And this is it back to the autoimmune topic is over and over and over and over. And that can include vaccine, bit by a tick, caught strep throat, now I took antibiotics, vaccine, now I took antibiotics and Tylenol, vaccine, got strep throat again, something else, pertussis. Oh my goodness. I'm just over and over and over again. And the immune system's like, I can't do this anymore. Yeah. And evidence has shown there's an actual mechanism to this, that when you do it over and over again, it actually turns on itself. And then there's no point of return once that happens. Yeah. So then we do the measures to help. To me, this is why I use low dose naltrexone, is at least let's bring us trying back to balance between our T helper cells so that we're not this imbalance anymore. Aluminum is playing a role within us as well because it has activated. We need to pull that out through also different measures, lymphatic support, drainage, binders, foot baths, etc., to get it out of the body so the immune system is not within this cloud and can't think or do. And if you're chronically inflamed, also don't expect to be doing well with infections either because that inflammation is getting in the way as well. And so vaccination is non-negotiable, very inflammatory. It is very inflammatory to make immunity towards a virus and bacteria naturally. But when you have a vaccine, you are usually always bypassing your gut and you go straight into the arm. And when you do that, the immune system is like, holy Toledo, how in the world did you just get there? Because usually you'll breathe in that antigen. I breathe in measles, I breathe in pertussis, RSV, whatever it is. And then my gut immune system is like, oh, we have something here. We're either going to get rid of it. My secretory IgA just gets rid of it. Or we leak through the gut, but we can communicate that something's coming. And then my systemic immune system's like, yeah, it's okay. We got this. So the process is there's more to the process when I receive it through my mouth than it is through, and it's a shock to the system when I receive it in the arm. Because like, how in the world did it get here? So now I'm pulling all these immune cells over here exponentially, and that equals inflammation as a result. Because to make that immunity is very inflammatory. So I think in terms of autoimmunity is where, to me, in my practice, is how many times have we activated the immune system to then make it turn on itself? Add in things like antibiotics and Tylenol, which are getting in the way, are part of the problem, for the body then to not be able to recover itself either, because it's just this tipping point and we're not sure when that will be for somebody. But it's almost bound to happen if you keep going and going and going. Yes. Yeah.
Well, and it's expecting some other kind of results for all these things not to happen. When we look at what's getting into people's systems over and over again, how can we expect a different outcome that we're seeing in the clinic, where it's exponential increase of autoimmune inflammatory conditions of all kinds? And well, a couple of things. I just want to take a breath on everything that you just said. That was beautiful and informative. And, you know, I'd be lying if I said I didn't feel some energy and some emotions around that, because as a practitioner who treats underlying root issues of autoimmune conditions, I've learned a lot of what those insults are to the body, those activations again and again and again. And so seeing autoimmune conditions in younger and younger people, and I saw this even within my career, that a lot of the things that were going on for like 60, 70-year-olds, then after, 4 or 5 years, kind of a decade, then it was like 40 to 50-year-olds. And then those conditions is more like 20 to 30-year-olds. And now I'm seeing teenagers, young kids, 11, 12 years old, fibromyalgia, chronic fatigue, rheumatoid arthritis, all of these different things. And somebody who's like 15, 18, like you should be bouncing off the walls at that time of your life and have tons of energy. In Chinese medicine, that's a very yang time of life, like where you have an abundance of energy for all kinds of things. So seeing patients that are the opposite of that more and more and more, and now, early on pediatrics with autoimmune conditions, it's pretty wild. And so what I'm also seeing is the ancestral pieces of how full was the cup at the time of conception for the parents. And so that is what I believe we're seeing now too, is the compounding effect of all these activations in the previous generation and the one before that. And that is stacking up. So you can have a newborn who has a cup that's almost full, and it takes one activation to topple the entire pile.
Yes.
And now there's a big mess. And so this is when people are asking, well, if one activation caused this in one person, how come it didn't cause it in everybody? It's because the cup is different. The genetics, the markers, the epigenetics, what was the parents' health and vitality, and how many toxins do they have in the system? How many activations have they had? Trauma is one. Emotional trauma, physical trauma. Like there's so many things that can activate the immune system, in addition to what we're seeing now, like earlier and earlier schedule of inoculations, beyond the point of the body being able to do something about that in a way that is not going to freak out. And it's already on top of a pile that might be there. And then the way it's managed, I've heard you speak about this too, it's managed with suppressive medication like antibiotics and Tylenol, which in a Chinese medicine viewpoint, those are all cold toxins. And the body doesn't like cold toxins because it pushes them deeper into the system. And then you're just kind of begging for a response from the immune system that's going to put a stop to it. And so I've always thought with autoimmune conditions, it's not a mistake. The body doesn't make mistakes. Nature doesn't make a mistake ever. So if it's choosing to attack its own tissue, it's because there's such a massive problem there that it really needs to address it, because if it has one more, it's going to be done. So then it mounts this massive inflammatory response to try and combat whatever the hell is going on there that is not natural or not naturally found in nature. Like you wouldn't take on 4 or 5 or 6 or 8 or 10 antigens in one day. You just, that'd be quite a day in nature. Walking through the forest and you got every sort of infection known just comes and finds you under a tree. Not going to happen. So then the body is responding to artificial activations in a really big way. And of course it's confused or has a massive response because it needs to. Otherwise, the alternative is, species gets affected in a big way. And so I think we're kind of at this tipping point where a lot of people are starting to learn this. I think a lot of what you and I are speaking about is becoming more understood.
Yes.
There's more research, just like you said, with the studies with the rats with aluminum. We didn't know that entirely before. Some of this stuff we've known for a long time, but maybe collectively as a society, we don't want to look at that.
Yeah.
But now it's so in our face that we have to, because a lot of parents that have kids that are having all kinds of neurological inflammation is massive, but body inflammation and the immune system is just running amok. That has to be addressed because it's so acutely affecting the population.
Yeah. Yeah. And even I just think about cortisol and the immune system. I mean, we think hydrocortisone cream we'll use for eczema. It's a suppressant. Cortisol will be high also when there is a problem. So there's an infection, underlying infection, and be it the immune system sees that, that vaccine too is an infection in itself, your antigens. So cortisol is a big problem in children. And you think about attention, inattentiveness, inability to fall asleep, kids that can't fall asleep, stay asleep. I mean, we're creating these problems. We are. And once we can communicate that and understand that and not be defensive to that, then we can move forward with solutions. And a lot of people, that's not. And it's okay if it did, because then if those actions affected your child, because guilt walks in and parents, and I can see it in reading the room, and why I will tread lightly with some, not our first maybe appointment, but our next appointment, we'll go there. Because I've had parents say, you know what, I don't want to talk about that. We're not going to talk about that at all. We're just here today for this. And I hear you. But in order for me to really heal your child and support your child, because you want X fixed, but Y is part of it. And so I know you don't want to talk about it, but I just want people to understand that Y, that understanding, so that if X, be it was the antibiotic, the Tylenol, the vaccine, I don't really care what it was, but if it was part of it and everything is on the table, then you're going to understand why I'm asking you to do this. Because and I want people to understand why I'm asking them to do X, Y, Z. I don't understand why you gave me this product again. Why am I doing this? Well, if you understand why you're doing it, you'll also be committed to doing it as well, because you understand why you're doing it. And you have to fulfill the commitment in order for us to start healing your kiddo, because sleep is what you want. Or you want them to be more calm is what you're wanting, because they're just off the wall and what have you. Or maybe it's rage. Or maybe your kid is biting you. Maybe they're hitting you. There's underlying tones as to why that's happening. And while we can learn different ways to parent, sometimes it's not going to help you entirely, because we can learn how to parent, how to speak to our children. But if your kiddo sees red all the time and they're hitting their head against a wall, maybe they can't speak, maybe they're itching at night and they can't sleep. Like, there's all these other undertones that your parenting style has actually nothing to do with it. And there's a lot of people that maybe it does, but maybe it doesn't when you've tried those things. And then we do infection and we look at infections. Oh, and there's Bartonella. What does Bartonella do? It causes rage is what that infection does. Babesia, anxiety, panic attacks, Lyme, all of it. Or maybe you had a strep infection, your kiddo had a strep infection, and they haven't been the same since, which means they're not leaving their room. They won't eat. Maybe OCD develops, tics as well. And, they're just like, well, they just have OCD. Okay. So we've labeled them with OCD. Okay. Now what? And so be it you need to go on an SSRI that your psychiatrist is giving your kiddo, and maybe it helps a little bit. But again, you're suppressing the real root here. And maybe your kiddo has pandas. So now we have to look at that strep infection, and be it now we have an autoimmune, and now we have to fix it from that angle of the strep infection, the autoimmune, versus the OCD piece. So there's different ways to look at this. But again, we have to look for the root too. And immune activation over and over and over again, be it led to that problem, you're more susceptible for that problem to now happen too.
Yeah.
There's susceptibility. When people talk to me about infections and vaccine discussions, which I have with hundreds of parents, is, okay, so which vaccine should I do? Is always the biggest question. Well, I don't know. Which infection do you feel the most uncomfortable with? And we have to get to know the infections first before you start deciding which vaccine should I do. Get to know the infection. How do you feel about the infection first? Like, okay, so your kiddo's going to get sick no matter if you vaccinate or not. You can't avoid all infections. Also, just because your kiddo is vaccinated, they're not in a bubble and never going to get sick. They will get sick. I'm going to tell you, they're going to have a fever. They're going to maybe vomit, diarrhea. You're going to deal with things there are no vaccines for. Pinworms. You're going to deal with these things. Now, is your kiddo's body susceptible for that infection to become a problem or not? Or are they vibrant kiddo? What are you doing to maintain vibrancy too? And so I am not saying you should contract X infection. No, it's not what I'm saying. Is your kiddo at risk means are they susceptible when they contract? We're all the same. If someone in here had measles right now and we're all sitting in the same room and someone's coughing measles, we're all the same risk of contracting measles because we're in the room with it. But whom is that measles infection going to actually affect more so and become a problem is the susceptible one. And that means be it you're mentally drained, you're physically drained, you're exhausted, you're the one that measles infection is going to be a problem with. Where everyone else in the room who doesn't have immunity probably because it wanes, even though you've been vaccinated when you were 12-month old or even when you had kindergarten shot, you probably don't have any immunity anymore. So we're all actually don't have immunity. We're all at the same risk, but who's susceptible? And I think that's more so what's important today is your susceptibility to that infection versus the risk of contracting the infection, or what's the rate of the infection that's around me. I should probably get vaccinated because this is what the media does. Oh, we have 2019 when we had measles in BC. It's like, okay, well, so the measles vaccine definitely increased. And those who already had a measles vaccine decided to get another measles vaccine. Did you need to actually do that? No, because also with vaccines, you will reach a threshold of your immunity that you can with that artificial immunization. You'll reach a roof with that. More does not mean more also. So it's sort of the flavor of the month, of course, in our decision making, but boils down to what's susceptible, how susceptible is that body to that infection? How healthy are you? We have to look at from that framework instead of reactionary of, okay, well, I'll just get a vaccine and I'll be fine. Not necessarily. Your tool will not work. That tool will not work if your immune system is not healthy. If you're on multiple different medications, you don't take care of yourself, you can't make good immunity to that vaccine, period. So you have to make sure that you are well. If you're going to use the tool, make sure that you are well. And if you decide not to use the tool, again, still make yourself healthy enough so you can deal with those infections. Along with, I like for parents and myself to have things in the house that are antibacterial, antiviral, that will support you when and if you're sick, because you don't really know what you have. No one does at any given time of what infection they have. So then support yourself through that infection and do the means to help you. Not so that it doesn't develop into these more severe cases too. We can really prevent those.
Yeah, I think the health of the body, regardless, is still primary. And I think there's a lot of people walking around in the population as adults that have had a lot of immune system activations, and they're saying, yeah, but I'm fine. But underneath, they're not. And so then that one extra thing, or they go through, a heartbreak or divorce, or they get an accident physically, and then 5 years later or less, they have chronic fatigue, fibromyalgia, and it's the accident or the thing. But they're not looking at all of the stack of things that built up well before that without really realizing how susceptible they were. And so a lot of the patients like that come in to see me when I do the investigational aspect and some of the testing that I do in the clinic, I'll find all kinds of things that have stacked up. And they're like, yeah, but I was fine before this. And usually what I'm sharing is you weren't, though. And if you were really paying attention, you probably would have noticed some of these things that were going on in your life. Energy maybe not as good, focus not as good, memory wasn't as good, maybe libido was a little bit low, but we've talked about it a little bit. So many things are getting normalized now.
Oh, yeah.
Especially with kids, that is normal to have half the class or more have OCD and more and more and more.
Right.
And that's okay. Like, it's just kind of what's going on. And I think, no, the more disconnected we get from our innate immunity and our innate nature, the more we're seeing the autoimmune conditions. Because we're nature. I think that's what maybe people forget is, like, as humans, we're nature too. Right. And so if nature in this way expressing through us is manifesting massive autoimmune and inflammatory conditions, that's nature saying, you guys are so off track. Where did you get off track? What is really happening? And so, there's food, there's toxins, there's all the different things that we're taking in. Immune system activation seems to be a good
big one.
political word to use. But it seems to me it's simple in some ways. If we don't overthink it, if you put way too many things in the body artificially activating your immune system, you can only do that for so long culturally and society-wise before there's a big wave of problems. And now we're seeing those outcomes of too many stacks of things for too long, and also not addressing it maybe in anything other than a suppressive way. And I could say this about emotions in our society as well. That's changing. A lot of us are addressing these things and feeling our feelings. And guess what? That has a huge effect on the immune system. Some of the research that's out there of what anger and thinking about that and very frustrated, stress, what it does to your actual, T cells and B cells and the lymphocytes and everything else, massive impact. And also feeling joy and feeling happy and playing and being outside and exercising, huge upswing. So there's lots that we can do, but stopping the onslaught of toxins coming in is a big one.
I think as a parent, first step that I'll have parents do is nutritionally, let's see what our kids are eating that is suppressing the immune system first. And that's simply going to be sugar. I know it's easy to state, but your cereal in the morning with cow's milk, your kiddo goes to school, and be it whatever you made them for lunch, packaged and whatnot. Maybe it's a juice box as well. Come home, snack, and be a dinner is an actual good meal that they're having because maybe there's some meat in there and starch, etc. But on the whole, we have to start there first. What is suppressing their immune system? Because that also will be inflammatory in itself too. So starting with nutrition I realize that it's difficult. Breakfast is where we start with, if we can, number one, that meal first. Because that's usually going to be the quick meal of the morning. Usually sugar laden, typically, because it's cereal or Pop-Tarts or something, right?
The cornflakes, Rice Krispies generation over here.
Right, and did grow up with that. Absolutely, the 80s babies in the room.
That's right.
But that's a first. And second is what they're drinking. Just keep it to water. All a human needs is water. They don't need the juice box. They don't need, and I think sometimes we'll do things for children, to have the little bit of joy in their lunchbox because maybe, we're not able to go, let's say we can't go to the movies, can't afford to do that. Or maybe we can't go on a trip, we can't afford that, but little joy in each day that I'm going to give you, but it's actually, it's harming them. And give them water. And when it comes to the worst time of year is going to be October to December. And teachers all hate us and those that send their kids with candy, obviously, because you've got the lead up to Halloween, post Halloween, and then you've got Thanksgiving, be it stuff happens there. And then you've got December, Christmas, and there's just treats and treats and treats. And so we're just doing our kids a disservice by sending them with that stuff. And so I hate the candy. Yes, my kids will go trick-or-treating and they will get candy. I
buy candy from my kids at Halloween. I want to admit that. We do trading. I'm like, hey, you can keep some of this stuff. I'll literally buy this stuff off of you.
Oh, well, the Switch Witch comes to our house, and no matter what, another thing, the Switch Witch is going to take all of your candy, regardless if you're going to hand it over or not. So they will know one day that, I actually think my son's figured it out. He's like, you're a Switch Witch, aren't you? I'm like, I probably am, because you switch out a gift for all of their candy. And it's just, I get it. It's fun. The night is fun, and that's great. But I just cringe at what's in the candy for them, like the colors, the artificial XYZ, and it kills me inside. Sure, okay, they do because it's there, but the limits, and they do not go to school with it. They're not going to school with it. So they'll come home and I will pick through them, and we've talk about with your kids with this stuff of how do they make it red, and what are they using to make it red? What are they using to make it blue? And so when my kids understood, because it is what they're using to make it red, they don't want to eat it anymore.
Yeah.
They make that cognitive decision to not want it. Like, okay, mommy, we'll just do the chocolate stuff.
Yeah.
So all then the candy garbage goes away, and then we're just doing the chocolate, which really pares down what's left, and then we go from there. But having those kind of conversations with your kids, they can handle it. They can handle these kind of conversations and understanding and reading the label and what is this, the curiosity. They will, once they get it, they're like, they actually decide not to do it too, because they understand where it comes from. So starting there with nutrition, the sugar, only water, these kind of things can really turn things around for behavior, skin, gut, microbiome, etc. So your child is not susceptible to these infections, and susceptible then also to things like something like pandas. We don't want our kiddos for that to develop, because now we've got all these other things going on with that OCD and ticks and etc. And Canada doesn't understand pandas. The States more so does. But Canada's...
We don't seem to understand a lot of things here for some reason.
I'd give us...
Interesting.
We're like 20 to 30 years behind. I mean, I am constantly embarrassed when I go to any conference in the United States. And I will go, and there will be, LDN again, because I love it. There'll be a pharmacist and be like, oh, LDN, and we can use this topically for eczema. Even me not knowing that you can use it topically, like, you can use it topically. And they look at me being like, obviously you can use it topically. And me being a Canadian, like, no one knows you can use it topically. What? So then this be it I'm going to use it or not. The point is that as a Canadian, I go to the States and things that they're doing, I look completely like, who are you, Canadian? How did you not know this? Well, hi, us Canadians don't know that you can do this because no one's doing it.
Busy in our igloos, just hanging
Pretty
out.
much,
Not researching.
Don't have internet
medicine.
in Canada. Yeah.
I definitely have felt that way at seminars, conferences, especially from a European background of teachers coming over. Some of the stuff they've been doing there with beautiful success for like 30 years is maybe just starting here a little bit. And you're like, wow, this is amazing, cutting edge. And they look at you like, where have you been? And we've been doing this for a couple generations already.
Oh, yeah.
Which is fascinating when we look at where we're at with our population. And I would say from a research point of view, because I read medical research and science was more my background, and I got into Chinese medicine, so I know how to read that stuff. And I like to pay attention. Some of the things that are understood at a research level really clearly won't actually land in an office from a conventional doctor point of view, typically for 15, 20 years or more, where it almost gets adopted or accepted as like really good practice, even though it's already really well established and understood, and maybe other countries are doing it. And so I want people to kind of take these messages that we're saying and use it practically of how are you going to apply this information in your life to take in less toxins, to make better decisions, and understand that there's way more information out there that is actually getting more available that you can get through your own mechanisms. And I know people say, don't Google that or don't Google that, but get into some chat forums with other like-minded people. There's a lot of parents out there that understand what pandas is really, really well. And they understand all these different aspects of spectrum issues and neurological aspects really, really well, because they're in groups of thousands of other people that have been through the fire with their kids or been through autoimmune conditions or any number of things and have found success and are getting results. And I'm not saying to listen to everybody on any internet chat forum. That's not what I'm saying. But if you can start, sifting through some of that material and talking to people that have walked that life and had success, ask them what they did. There's clues there. Or, come to see somebody like you where, there's this notion I've had for many years of the circle of competence. I think this actually might have been a Warren Buffett book I read like 20 years ago. But I can take that into health. And the idea is that in my circle of competence, there's only a few amount of people that I trust to give me good data and to give me good advice or good information, because I know them and I know that they've looked into it at a deep level. But I find in society that's not necessarily true very much, that if somebody tells me something, I evaluate, is that person in my circle of competence in the category of what they're speaking about, that I know that they understand that deeply. And I don't always feel that very often, and maybe it's just my own neurological wiring that I investigate a lot of things because I want to know. And what that taught me as this point in life that I'm at now, most of the things that I've heard second or third hand, when I do the deep dive research on it, not true. And I'll find more and more layers to those things. And then that has taught me, don't take somebody's word for it necessarily unless you've looked into it. And so from a practitioner point of view, I know that circle of competence because we've had conversations before. You read research, you've seen tons of people, you're asking those deeper questions. And so I have a really good sense that all the things you're sharing, you've learned yourself directly through education, through teaching, through reading, through clinical established, efficacy, which is something I put at the top of the list ahead of any kind of studies. I'll just say that. Any studies, double-blind, placebo, control groups, all that kind of stuff, I will always put clinical relevance ahead of any of that, of what I see with my own eyes. Yeah. That if I'm treating latent infections and then somebody is now rid of their illness and their symptoms and their blood work matches and everything else, that means a lot to me. Even if it's one person. They say, no, you need 1,000 people to have that be relevant. I'm like, no. For that person, it's relevant because their life has changed. Yeah. And then it turns out I can apply the, learnings and teachings to everybody else with the individualized nature of the medicine that we practice. And I think that's where it's really potent. It's individualized.
I have, my patients have taught me so much.
Yeah.
So much, which I'm incredibly grateful for. And even this journey of me understanding vaccines at a deeper level comes from my patients. I did not choose this. It was chosen
we don't always
for
choose our
me.
path, right?
I knew nothing about vaccines after graduation. I mean, I'm taught as a naturopathic doctor, same as your medical doctor. I'm taught about the infections and I'm taught about the vaccines when they're given. That's it. Nothing more to that. But it was my patients that were teaching me and proving to me on things that are no paper is going to teach me. And so the real life evidence is right staring at me when I'm in my office. And because that when a mother comes in, with certain things have happened to her kiddo and she starts unpacking what's happened, I'm listening. And I think a lot of times as practitioners, we're like, well, that's not what the textbook says. So, no. And so I have learned, and as a mother myself, that mother and fathers, I'm listening. As a naturopathic doctor and yourself, I don't have patients that come in that are malingering. They are not faking it. It is absolutely true of what's coming in. And you're not going to pay me to tell me something that's not true. You're going to pay me to tell me so that I can fix it for you. And so each of these, every single story that comes in, and a lot of them are going to have similarities to them as well, which has taught me what to ask as well so I can get to it faster than like the third visit, like, oh, okay, but this is where the wisdom of practicing longer and longer, where you can figure these things out quicker and quicker. But the evidence is in front of me. And so their story to me is, okay, I highest regard, because yes, that helps me for the next patient as well. But it's not going to be black and white in that sense. But, when you tell me something and then I fix it with something and it's fixed, well, because I know why it's fixed, because I know what the cause was. But when it comes to something like, the idiopathic conditions of pain, fatigue, there's a multitude of things as to why that is. But as a clinician, then we have to start asking those deeper questions to figure out the cause of disease and then go from there. But what I've learned, I am grateful. I mean, and I think that's why I love what I do. And it's not a job. I mean, it's a job, but it's embedded almost in my core, and finding the solution to patients. And you have a kiddo that's not sleeping and now sleeping, or a kiddo that has violent constipation. We're not going poop for 2 weeks, and we find and Restoralax and everything's been used, a PEG has been used, and you find and you fix it. I mean, these are some of those beautiful things to experience as a practitioner, and I know you've experienced that over and over and over again and continue to do so. But that's the beauty as a practitioner, is finding, and it's so different for everybody. And one thing helps for that one person that never helps again too. Sometimes it's frustrating because I wish it would. But that one thing, it doesn't matter though, because you've found out what that person needed in order to achieve wellness. And that's really our mission as any practitioner, medical doctor or not. Our mission is always, we got into this to help patients and figure out the cause. Really, I mean, we think, okay, pain med, but if you can really find out the root, I mean, you save someone's life. And that's why I love treating children, because you're treating the entire family as well. And if a kiddo can't, again, to the sleep, because that's just a huge piece. I have parents whose kids are waking every 30 minutes at nighttime. I mean, you're not living. You can't.
Yeah.
And just begging for something to help their kiddo, and finding out brain activation, or we got neural inflammation going on, which is, I think, a huge problem. That I think is the problem in children today, is neural inflammation. Behavior around neural inflammation, we're going to see a whole different thing. If you've got neural inflammation, you're going to start affecting cranial nerves. You're going to be affecting how one speaks, how one walks, how one thinks, how one behaves, when you have inflammation on the brain. And we can create it. We can create neural inflammation. We can also stop it, but we also are creating it. And so when I see a child that, be it is developing well, and then now something happens, it's neural inflammation to me until proven otherwise.
Yeah.
You don't have autism. You have neural inflammation. That's going to hit home for a lot of people, or you're going to be angry with me when I say that. Autism today, rates are going up, obviously. Maybe not obviously, but the rates are going up. And people say, well, the rates are going up because we have better diagnostic criteria. The rates are going up just because it's genetics. The rates are going up just because that's just the trend. To me, is a lot of children that come into my office don't have autism. And autism, to me, autism is a child that can still speak, that can still function. As an adult, they'll be able to take care of themselves. Their autistic tendencies are going to be neurodiversity, brilliant. These are the things that come with being autistic. You got quirks to you, but you can survive and live in this world on your own independently. The autism spectrum disorder, though, is including children that seizures, hitting their head because they probably have pain, OCD, can't speak, global development delay, perhaps, and PDA is under that, pathological demand avoidance is also under that, the umbrella of autism. When your kid is diagnosed with autism, the road has ended, meaning now we're going to go OT, ABA, and speech pathology because you have autism. If I was to diagnose it, or the child was diagnosed with neural inflammation, you now have something that you need to treat. If you have low-grade encephalitis, now you have to do something about it. And if that low-grade encephalitis is affecting your child or your ability to think and be in this world and your behavior, yeah, we're going to do something about that. But we're labeling children with autism, a diagnosis, which gets you funding, which I absolutely understand. Because now you have help. Now you get an EA in the school. I get it. But as a practitioner is, while you have that diagnosis of autism, I am going to be looking for underlying conditions, because I do not think your child has autism. I think they have neural inflammation. And that hits home for some, and some don't like to hear that. But to me as a mother, I think that your child is not reaching their genetic potential. As parents, you want your kiddo to reach their genetic potential, their potential. We all agree that we want our children to thrive in the world and do what they were destined to do. Are they destined to be married? Are they destined to have children? Are they destined to travel? What is their destiny? And I do not want to do anything which affects that ability to reach that potential. And if something has happened for them to reach that potential, let's do something about it. Regardless of that they've been diagnosed with autism, your kiddo, I can see clearly, is not doing well. with, yes, they're diagnosing, they're getting help, but they're not doing well. So let's do something more. And this is where the biological model comes in, which people poo-poo, but there's nothing, we're not going to change your child. We're going to support them to become, again, whom they're destined to be. And this is where the movement of different, this is where Dan came in, Defeat Autism Now, which is now developed into MAPS, the Medical Academy of Pediatric Special Needs, which is a conference that I try to annually. There's not a lot of MAPS trained docs in British Columbia or really Canada, because it's just another conference to go to in the States and what have you. But it's an amazing starting point. MAPS is great to give credit where credit deserves, that the research is there to show that our kiddos, there are things wrong. And while we, again, want to just easily give that label of autism and stop there, there's more to it. And this is where I will say boldly, vaccines don't cause autism. They don't cause autism. Autism and being autistic, again, is you live in this world, you're speaking, you're thriving, you've got quirks. That's autism. If we're going to give autism a label, everything beyond that isn't autism. So what is it? Again, neural inflammation, encephalitis. And what does the BC Center of Disease Control in terms of potential vaccine adverse reaction state on that under neurological is encephalopathy, encephalitis. It's a potential adverse reaction. So they've listed it. So what could potentially be the cause of that? We're activating our immune system over and over again, but it's inflammatory process. The whole process is an inflammatory one. And if that body can't handle that inflammation, and we're now hitting the brain, we can almost for sure expect there to be changes in neurological development as a result of that inflammation getting in the way and hitting the brain and having neural inflammation. And it's going to be really mild. It's not something you're going to see on imaging. It's not. Or as a parent, if you've noticed that something too has quickly changed with your child, we would go, what's going on in the brain then? To change what has changed. And so this is where you wouldn't want to be using Tylenol, but you'd want to be using, if anything, Advil. Stay away from Tylenol. Please, everyone stay away from Tylenol. Advil would be your next thing if you're going to use something. And so even kiddos that have flares, pandas, and if they have flares, I will go to Advil quickly or ibuprofen quickly to help knock that flare down so that we can prevent something like a seizure too, because we don't want them to go to that endpoint. So I think the discussion, and I have spoken at MAPS the last time around this particular narrative that vaccines don't cause autism, because you're seeing more and more in the news around vaccines and autism. And people send me all of these articles, see, vaccines cause autism. And I will always disagree with that, because again, that's an endpoint. But if we call a spade, and if it's encephalitis, you change your wording that vaccines have the ability to cause encephalitis as per the vaccine insert state, as per the BCCDC, then you have something tangible to work with.
Yeah.
And when you have a parent that says, I recovered my kid from autism, they never had autism in the first place. You recovered your kiddo from neural inflammation is what you did. And now your kiddo they're making eye contact with you. Now they're speaking. Now they're walking in a straight line versus all over the place. They're developing because you fixed the brain is what you did. That's what you did. And that's what, be it stem cells will do if parents induce stem cells. Hyperbaric chamber is going to do that. Fecal transplant is going to do that because the gut-brain connection. You're doing the things that are healing the brain is what you were doing that entire time. And then they lost the diagnosis of autism. They no longer have autism, the diagnosis of. Now they have a kiddo that is thriving and destined to be where they should be. And I think that's it's a tough conversation, but I think these are the kind of conversations that we have to have in order to A, prevent, B, heal our children from something that, oh, they have autism, I can't heal them. They're autistic. I don't know, but I know there's something wrong. They're sick all the time. They're having a seizure. Their vocabulary is less and less. They will not make eye contact with me. And so if we recognize this earlier, we can help that body heal. We can totally do that. But it's when it's left. And by the time the kiddo hits age 10 to 12, it's really hard to really get that back to where they were when they were 2 months old.
Yeah.
We can make movement in stride. But when I see children that are 20 now, it's more of maintenance and support than it is in terms of alteration, because the brain is now as the brain is. Mm-hmm. So, yeah.
I think that, well, thank you, because, there's so much confusion about probably most of what we've talked about, autoimmunity, all these different things. There's so much differing data sets and opinions. And, I would say for me, from a clinical point of view, whatever somebody presents with, especially if there's a label of any kind, adults or kids, I usually take that label and I go and set it over to the side. Yeah. And then I want to get down to what is causing disturbance here on any level.
Yeah.
Whatever system, nervous system, brain, like all of it, immunity. And I want to get down to the root issue. And even if they have a diagnosis of autism and it's not neural inflammation, I still think of it similarly. And I love how you said that. Like, are they at their genetic potential? Yes or no? And in Chinese medicine, we have this beautiful saying called nourishing your destiny. And so that's often in the back of my mind for almost anything I'm treating is let's nourish their destiny here. And often there is a gap from where they're at and why they're there to where they could be. And then as we pull all these things out of the system that shouldn't be there, or the things that have really caused, stimulation to the places you don't want overstimulated, their body starts to calm, you get more harmony, and all kinds of things start happening. And I feel really blessed. We talked about it earlier. This career, like this mission that I get to do, or we get to do, is one of the most rewarding things that I could ever imagine. And sometimes very challenging because we're learning things that are maybe new, or we're investigating things that we don't know the answer to, but we're going to do our best to find it. And then there's the most incredible feeling seeing people heal from longstanding imbalances or inflammatory responses that then they don't have. Yeah. And the way that you see them in the world, or the way that they, shift after that. And they go on and get married and have kids and are healthy and thriving. I think that we do want that for our kids, and we want that for our patients as well. And I've also had, I think, a lot of rare privileges to see people older than 10 years old, 12, 14, whatever, could be 20, 30, 40 or beyond, shift things at a level that typically would not shift if you get really deep. And maybe those are a little bit harder, because I agree that the longer something goes on, the longer it's going to take to solve those patterns. Yeah. And the more sort of rigid a system gets, the harder it is to kind of shake out what that initial factor was. But the body also, I've learned, is tremendously resilient if we give it the right time and resources, or we clear the pathway and offload things that aren't serving them anymore. Yeah. Stuff starts happening. And this is where I see nature come alive. It's like, a forest fire goes through and decimates a forest, and some years later there's the most abundant life there too. And so we have this resiliency in our systems, and I think we're both working in different ways to uncover that and nourish our destinies.
Yes, absolutely. No, and I think I love the forest fire analogy, because it brings it back to the autoimmune piece. And I think that's where sometimes, in order for you to make change as a person, like, you have to have a symptom or sign that now wakes you up to make change, because your body can't actually talk to you and tell you what its problem is. And now it's like, that's enough here. And now I have pain. That's enough. Or whatever it is, or growths, that's enough. I can't do this anymore. Please help me. So take that, and do something about it. Don't ignore it. The stubborn farmer that ignores the pain or whatever it is, and finally goes in the hospital. Now we know it's a problem because the farmer's there. But don't be that person. If you're recognizing, and that's where even prevention comes in. Like you and I both. I mean, I'm doing things and taking things that, are, be it nuanced now, older, but are newer now, and I'm using them, to help with longevity and paying for it, for sure. None of it's free to me. I had to pay for it. And doing that, and my own children, I have a whole basically dispensary at home of supplements
Yep.
that they take here and there, not every day, but that I'm trying to maintain for their bodies too, because we try to eat well. But, I don't know what's in some things that I buy, and, it is what it is. And so, because I can't make it, but we need it, et cetera, or want it. And, but doing the best that you can with what you have. And so, I think that be it 2025 is the time that we all step up and really make us first and I think part of why I love also treating children, I mean, it's treating a community. And so I really want my community to be strong and healthy and vibrant, because it just levels everybody else up as well. And so those little changes make huge strides. I mean, you flip from drinking pop to just water, you will see changes too. You might have a headache at the beginning, but the monster drinks, like enough, that kind of stuff. These small changes can make huge, huge differences. And then when you get sick, you will recover from it. And sickness every single year will happen. And so it's just a different flavor of something else that is, this year it's a gastro bug, or this year it's a lung bug, or this year it's a nasal bug. It's going to be something every single year, but we have the tools that can help us through that. But we have to take accountability of us and quit blaming other people as to why I feel this. And the finger pointing game, I mean, COVID allowed it, but I will point out that you can't point at someone and say, you're the reason that I'm sick. That's enough. You are the reason that you are sick. You're going to live on planet Earth. You're going to contract infections, period. Yeah. And so if you're not ready to handle that infection, that's your problem. I'm sorry to say. But you can do the things. You can, and be it's the kick in the butt that you need right now. Drink more water. Go to bed earlier. Quit being on your phone until midnight. Do those things. Movement, obviously. Yeah. Do 10 push-ups. Do some sit-ups, what have you, to get things moving. It's all the basics are always still the best. Always.
Yeah, simple can be effective.
Oh, yeah.
And I love what you're sharing. I feel like that's where we're going in collective health overall. We're in this new phase of humanity. There's so many things shifting and changing all the time, but we also have access to way more information, and we can apply that if we're paying attention and take more self-responsibility. And, I think that's more the wave of the future. And that's how I practice. That's how I live my life too, that I'm manifesting all the things, whether good or not. I'm going to need to address the things where there's pain points for me and on every level, but then it liberates so much. And then you can come up to a higher level, and the body responds at an immune level to that as well. And once you start kind of moving in that harmonious way in our bodies, we don't have to be perfect. But if you apply, anybody listening, if you apply even a little bit of the things that we've shared today, that can be life-changing. Small steps, can take you a long ways. Absolutely. And, reorienting a compass direction. Speaking of direction, and we'll move to wrap up, because you and I could keep riffing all day. I know for sure, and I love it. Thanks to our live studio audience over here too, hanging out with us. What's your direction, the rest of this year, next year? What do you want to create? What are you excited about? How are you orienting your practice? And
thank you for asking. So, a few things. I have a webinar series, an 8-part vaccine webinar series,
awesome,
which I am wanting to make into a journal. And that journal I want to make into a book. And so just each step by step. But that book, which I've already looking at collaborating with a few individuals, immunologists and pediatricians, we're going to hone in on this infant immunity topic. And
Beautiful.
So we're going to hone in on that. Because I think it's a big missing component that's where it begins in terms of that developing that heart attack at 50 began in your 30s. That autoimmune started. It can start in infancy, and you can start layering. So the journal and the book. I'm going to be, say this out loud, I'm going to be creating something that'll happen, a course with Dr. James Lyons-Weiler, who owns IPAC. So if anyone is aware of IPAC, and on a naturopathic medicine course, it'll be 10 to 12 weeks long on all the bits in terms of naturopathic medicine and gut health and sleep, etc. So that's in the works of making. The clinic, though, the clinic, we're growing. I'm looking for a midwife too. Salmon Arm doesn't have any midwives yet, so that's something I would love for the clinic and for the community. But more naturopathic doctors also I would love for the community because we're busy. But that's, and more podcasts. I have a couple more podcasts to come up, some other big, amazing men that I'll be speaking with. But yeah, I think that's going to take me all through 2025. The journal and the book and the lecturing. Hopefully also more lecturing as well at some conferences. But that's about.
Oh, thank you. We'll, all of us will help you call in these next levels of things that you want to experience. Yeah. And I also just want to say thank you as a practitioner to another practitioner who is doing really deep, important work and sharing and educating patients and doctors and other practitioners on things that maybe they haven't understood well, that they need to. Yeah. And I can really appreciate that because it's sometimes a bit of a lonely path. Yes. I'm not going to project my own stuff, but I have felt the lonely path at times in finding out things or making discoveries and getting insights about things that are not well understood and then bringing that forward. And sometimes there's a lot of resistance and it can be a challenging place to be. And so I really appreciate your bravery and your courage and your heart of wanting to make a powerful impact, especially right in the beginning of people's lives. That is exponential in terms of the impact that can be made. And so thank you for doing what you're doing.
This is awesome. Yeah, because it can feel quite lonely. It has been lonely. Yeah. And even I've had colleagues, say, why are you doing what you're doing and shouldn't, and all these things in the background, although there's been the positives as well of, you're brave to say X, Y, Z. I don't feel brave. I think it's just innately part of me and you to share that information. And some people don't share the information because they think it'll affect their brand. And so I think we have to stop thinking that way completely. And as a practitioner, we're in it to heal. And so share what you know. If you know something, share it. If you have a gift of something that you've discovered, share it. And so, because then we can heal as a collective versus individually. And it'll levitate you even more by sharing it too. So I've learned that hard way, be it now it's the easy way. But thank you. I appreciate that because it's been very rewarding, challenging, but very rewarding though. Yeah.
It's a unique path to be on, I think. And it's a unique time, but an exciting time. And I think a lot more people are starting to understand some of the stuff that we're sharing and teaching. And that's one of the reasons I started this podcast is I've learned a lot and I'm going to continue to learn. And I want to share. If I just keep it all inside, how is that of service at a big level, and I'm here to make an impact. And, I feel that's what you're here for in lots of levels too, with our humble beginnings, but we can make a difference. And so, I hope anybody listening still is having an impactful time with taking in some of the stuff, and you can change your lives for the better. So thanks for taking a bunch of time to connect. Totally. And now we're going to enjoy White Lake Cabins. Yes. We got some food. We got sauna. We've got an amazing crew over here supporting what we're doing.
This is great.
Yeah, it's going to be a lot of fun.
Listeners, you do need to check out White Lake Cabins. It's a beautiful place. There's no internet. There's no cell service.
Yes.
Is what you need. All of you need it.
Time to unplug. If we're getting back to nature and connecting, and it is a healthy thing to do, we need time. Take some time out, reset, pause a little bit. We're going to have, it's nice and chilly today. What is it? -12, -15. We're going to cold plunge, bust up that ice a little bit. Should be fun. I see a lot of smiles.
Break through the ice.
Nervous smiles over here. Yeah. It's gonna be good. And this place is well situated to retreats and I love doing retreats, and I've got friends that do retreats. They're in this room, Pam and Heidi as well. And I know you guys host retreats and weddings here. I'm looking at Natalia now, the owner here. And gosh, what a beautiful place. And I'm looking at the hot tub out the window. I'm like, oh,
steaming. Yeah.
hello.
Ready to go.
Yeah, maybe we should wrap this up and go and nourish our destinies a little bit.
Nourish our destinies. Here we go.
Yes. Thank you. Thank you so much.
My pleasure. Awesome.
All right. Boom. Here we go.